Great. We're live. Um, cool. Dr. Sanda, it is great to have you in today's webinar, focusing on oral health and all things related to integrative dentistry. I'm gonna start by giving our audience a little bit of a background on who you are, and then obviously you can elaborate on that. Then we can, have a conversation around the things you've been doing with PNOE and also the things you're doing in general when it comes to integrative dentistry. So
Sound
Dr. Sanda is a renowned integrative dentist who has been utilizing PNOE for quite some time now in order to provide an assessment of a person's breathing patterns and also metabolism and other things related to their underlying health, and utilizing this data in order to provide a more holistic approach in their care. That includes training, nutrition, breath work, and also understanding of how their craniofacial evolution is changing their breathing and vice versa. This is actually something that we're going to be discussing quite a bit in today's webinar. So Dr. Sanda, thank you so much for joining again.
my pleasure.
Floor is yours, and yeah, tell us about yourself.
Yeah, Panos, thank you for having me. I'm excited to contribute. I was very interested in PNOE because of the sleep apnea patients that I have in my practice in Beverly Hills Dental Health and Wellness. We have 3 locations. And one of the things I like about your equipment is that it's portable, actually. So that's kind of nice. But for people with sleep apnea, I wanted to know, to look at, their airways, their lung capacity. We look at the holistic approach, like if they have tongue ties, whether or not their palatal arch is shaped differently. And, now with this cutting edge laser technology that we have, I'm able to change a little bit of the soft tissue and open up the airway. And then what I want to do is actually do the testing of the PNOE test after their treatment, after they're able to at least open up the airway to breathe better, to see how their parameters change, with this new airway that we can create as dentists.
Mm-hmm. This is a very interesting application of breath analysis that many affiliates and health professionals out there are not familiar with. And just a little bit of background from our side, that we're having visibility over tens of thousands of tests being conducted every month. Airway obstruction and respiratory-related problems are by far the #1 type of problem that we encounter. And in many cases, we identify some sort of breathing abnormality, and we ask the person whether they have a known respiratory issue. And in many cases, they respond, yes. And sleep apnea is one of the most common respiratory issues that they're facing. And they are unaware of the fact that there is, oral procedures, right, that they can do in order to overcome that. So a question for you, is that a similar trend that you're seeing in your patient population? Are your patients knowledgeable about the interaction between the way their mouth is forming and breathing, or is that not the case?
Well, unfortunately, Panos, it's not the case. And I think in general, sleep issues are really being undervalued when it comes to longevity and health.
Mm-hmm.
It's kind of overlooked a lot of times. I think it's becoming more popular in terms of looking, okay, well, how are you sleeping? But really, a lot of my patients are really don't understand the implications that if somebody has sleep apnea, they have a 47% chance of dying in their sleep, which is very high. And a lot of, people don't know that. Like, yeah, I'm snoring, so what? It's like, yeah, maybe the only reason they would do something about it if they disturb their partner.
Yeah.
But yeah, so, and then what's being done traditionally today is you go to a sleep doctor and they put you on a CPAP machine if you have moderate to severe sleep apnea.
Or you get a separate room and you're basically shoving the problem under the carpet, right?
Exactly. That's
Yeah,
right.
yeah.
But about breathing disorders affect about 20% of the population, so it's still pretty high, especially mostly in men, but also in women.
Hmm.
I actually had a young patient in her 20s
Oh,
who was
wow.
actually snoring. And why
Hmm.
is that? Why? And even children, actually,
Hmm.
you'll hear them sometimes in a teenager snoring.
Hmm.
And that's really the time for intervention.
Hmm.
Very fortunate to work with these great myofunctional therapists
Hmm.
to help, develop jaws and, the motion and the muscles of the respiratory system of the
Hmm.
throat to allow for better lung capacity and better breathing.
Hmm. 100%. Something that we typically see, which is perhaps something that you may also be seeing in your patients, is that there's a very strong correlation between people suffering from sleep apnea and people having some sort of nasal obstruction, whether that is sinuses or, in many cases, a deviated septum. So, is this something that you encounter? Is this something that you test for? Is this an examination that you recommend that should go along with whatever evaluation you're doing?
Great question. And if somebody comes to me definitely for sleep analysis, yes,
Hmm.
absolutely. We have to look at that,
Hmm.
especially in the people that say they're mouth breathing.
Hmm.
And mouth breathers in general, that's a problem that usually starts either because of a stuffy nose
Hmm.
or sometimes, enlarged tonsils
Hmm.
or just a narrowing of the airway due to like weight issues if somebody is
Hmm.
overweight.
Hmm.
So we have to look at all these things in order to help them with their breathing. And, mouth
Hmm.
breathers, interestingly enough, they actually have a certain morphology of the face because, their jaw is a little bit back and
Hmm.
undeveloped.
It's the
Uh,
long face syndrome, right? Yeah.
exactly, the long face syndrome. And you'll see like their posture, it even affects their posture. That's how far it trickles down. Their head is
Hmm.
forward, in order for them to try to get more air, even though it doesn't
Hmm.
really help. So it
Hmm.
really can mess up the entire like spine
Hmm.
when we talk about mouth breathers.
Definitely, definitely. And, this is something that we try to educate people with in our reports. There's a, specific section in our report that talks about breathing and posture, and we always
Mhm.
try to highlight the fact that if you have bad breathing, you're going to get bad posture, and then vice versa. Bad posture can then create bad breathing, which can then evolve into this whole cascade of negative
Mhm.
morphologies in your body, from the long face syndrome to all these blockages in your airways that can then trickle down to sleep apnea, which can then kill you. So yeah, breathing right is 100%, important. When it comes to the underlying like the common pathway behind most of the cases that you are evaluating, what would you say lies in the foundation of that problem? Is it the fact that we are eating very soft food? And I'm just mentioning things that I have personally read in, different books, blogs, or have heard in podcasts uh, as contributors to this, pandemic of bad breathing. So one thing that people put forward is we're eating very soft food, and that is not training our jaws. Something else is just, the exacerbation of allergies and things that block our nose, or just deconditioning in general. Have you found anything to be the most prominent underlying contributor to that problem?
When it comes to, nasal congestion and not being able to breathe, typically that trickles down to the upper palate or the upper jaw.
Hmm.
And Western Price, like you're
Hmm.
talking about, did research 100 years ago showing
Hmm.
that people with a more fibrous diet have better
Hmm.
developed jaws.
Interesting.
And he actually traveled to the Amazon, to the tribal areas, and he
Hmm.
looked to see that, the Western population actually has a lot more crowding,
Hmm.
and the amount of fiber was significantly less than
Hmm.
people, in the Amazon who had beautiful, perfect arches with wide
Mhm.
jaws.
I think this is also an example that James Nestor in his book Breathe or Breath, the Lost Art of Breathing,
Mhm.
also he put, he describes it. But can you share a little bit more about the interplay between fiber intake and the proper evolution of our jawline?
Absolutely. And what's interesting is that we can change the size of our jaws at any time during our lifetime.
Oh,
And I
wow.
do see this with my patients, especially the ones that even at a later on in life
Hmm.
decide to do myofunctional therapy, which is
Hmm.
basically like an oral physical therapy
Hmm.
with specialized trained, usually hygienists, who
Hmm.
can help people develop better habits of
Hmm.
swallowing. And
Hmm.
even just resting the tongue on the upper portion, on the roof of the
Hmm.
mouth, will help the jaw develop more. And
Hmm.
how do we know this is because, for 20 years, I've been placing dental implants. And
Hmm.
sometimes, we get people in their 50s started doing myofunctional therapy for sleep apnea. And all of a sudden we're looking and implants don't move, teeth can. And spaces start to open between implants and teeth.
Hmm.
How does that happen? The
Because
jaw
teeth move and then implants don't. So there's like
and the
spacing
jaw
that is needed.
changes. Correct.
I
And
see.
we've
I
seen
see.
changes in the actual, volume that's
Mhm.
right above the tongue and the arch itself. So we
Mhm.
can motivate the bone to grow
Mhm.
as long as we're alive.
I
Yeah.
see. The
And same
mhm.
with the fibrous foods, right? As we're chewing fibrous foods, the bone gets the message, okay, you got to
Mhm.
get wider, like it's
Mhm.
getting more stress.
Mhm.
And I think it also plays a role, the fiber itself, in the cleaning of the GI tract. And
Mhm.
that in itself, not harboring, bacteria in the back of the throat,
Mhm.
the tonsils. A lot of kids become mouth breathers because their tonsils are enlarged, and that's definitely due to food allergies or, not enough fibrous foods, I feel. So then they develop this, forward posture, mouth breathing. Their tongue is not in the right place in order to develop the arch.
Mhm.
And, we know it's so important, even when it comes to lung health, the air must be filtered through the nose
Through the
in
nose, yeah.
order to get to the lungs.
No, 100%, 100%. When it comes to myofacial treatment, is that how you described it?
Myofunctional.
Myofunctional.
Mhm.
What does that typically entail? And how frequently should one do it? And in what cases would you recommend someone do that?
With myofunctional therapists, it's great to start at the younger age.
Hmm.
So children as young as 4 years old can
Hmm.
go there. These are the children, for example, maybe who couldn't breastfeed, or they're having a hard time swallowing. They're breathing through their mouth, not their nose. But
Hmm.
also with adults that have clenching, basically adults that clench a lot and have
Hmm.
migraines, they can, myofunctional therapy can actually benefit them hugely. I've had patients that completely got rid of their headaches and their tightness in the jaw by doing myofunctional therapy.
I see.
One of the things that it's super important is to, also for people that cannot breathe well,
Hmm.
is to see where their frenums are. The frenums are these attachments that are right underneath the upper lip,
Hmm.
right behind the lower lip. Like when you pull
Hmm.
your lip out, there's a little piece of skin there that's connecting the lip to the
Hmm.
teeth. Or we also have frenums here on the side. And typically on the side here, when you pull your lip out, you see a little piece of skin. For some people, that's really tight. And one of the things that I do as a periodontist is actually release that to make it looser. And people say, yeah, I can breathe better because this is
Interesting.
actually pulling here
Hmm.
on the nose area.
Hmm.
So it's super important to diagnose these frenums in order
Hmm.
for the myofunctional therapy to work well.
I see. Two questions. How does one typically get tightening of these areas here? Like, what is the underlying cause behind that?
That is just an anatomical.
And
Frenums,
mhm,
yeah, it's just an anatomy.
mhm,
And some kids, like, I mean, when we're born, it could be really, really tight to the
mhm,
point where, when they put their tongue like underneath the lip, it hurts because
Mhm.
it's not elastic at all. It's a
Mhm.
very fibrous frenums
Mhm.
typically. And if they're present right underneath the tongue, then it doesn't allow the tongue to come forward also.
Mhm.
So people
I see.
with tongue ties actually
Mhm.
have a hard time
Mhm.
breathing, and part of their sleep apnea protocol is to release that frenum.
Interesting. And then how do you diagnose that? Like, how can you tell if someone is like tied to the frenums?
Yeah, good question. And actually, people can self-diagnose at home. Anybody listening to this, you know,
Yeah,
if you want to look in the
that would be
mirror,
awesome.
basically, I would just take the lip and pull it up, and it's
Mhm.
just right here in between the two front teeth. You'll find a frenum, and if you put your finger there, you can actually feel a tight band. And
Mm.
also, it's right in the lines right behind the canines, typically.
Mhm.
And you can feel it with your tongue, oftentimes, to see
Mhm.
if it's there.
Mhm.
And also here on the lower lip.
Mhm.
Same thing. If you put your tongue like right in the back there, you can
Mhm.
feel it to see. And in terms of the tongue,
Mhm.
you can just raise your tongue up like this and look to see if you see a tight band
Uh-huh.
right there. So that if it's super tight and you see it pulling and you can't really put the tip of your tongue
Uh-huh.
behind the upper teeth while you're opening,
Uh-huh.
that means the tongue is too tied to the jaw. So a release
Oh,
must happen. Yeah. So if you're seeing,
very
if
interesting.
anybody listening is noticing this, I would definitely, search for somebody who does tongue tie releases. And typically periodontists,
Mhm.
ENTs, they do this,
Mhm.
or just start with a myofunctional therapist and they can point you in the right direction.
This is super interesting. And when it comes to this type of like physical therapy for the mouth, is it something that someone can do at home, or is it something that you need to work with someone on the day to day, or even virtually? Like, does there have to be like constant live connection with a therapist, or can one find like on exercise online and just follow them?
Great question. Ever since COVID, most myofunctional therapists are now online.
Mm.
And they have programs that are 4 months, 6 months,
Mhm.
sometimes a year long, depending how
Mhm.
severe the problem is,
Mhm.
and depending on whether or not they need this tongue tie releases.
Mhm.
And exercises are being given
Mhm.
just, one-on-one. And then typically twice a day, or at least once a day, the exercises must be done on your own. And you
Mhm.
just check in with the therapist because they want to see, they assess things and the movement
Mhm.
in the mouth and the tongue to see
Mhm.
how much stronger the muscles have gotten.
Mhm. I see.
Um, yeah. And so it's a very easy thing for everyone to do since they could do it at home.
That's awesome. And
Mhm.
from your experience, like after putting someone through an intervention of that nature, which may include, one or more of the things that we talked about, how soon can one expect a significant improvement in their breathing, which will obviously translate into fewer sleep apnea incidents, or perhaps even total elimination of sleep apnea?
And of course, this is a generalized
Mhm.
answer because it depends, if somebody's overweight and they need to lose
Mhm.
50 pounds before they can
Mhm.
breathe better. But typically 3 to 6 months. So people that
Okay.
have, so pretty fast, I think the
No, that's
muscles.
very fast. Yeah.
Mhm. Yeah,
In fact,
it's
in many cases, we recommend people retest with PNOE every 3 months. So this is, well within the retesting range. I see.
yeah.
That's awesome. When it comes, let's go back to nutrition, because there's a lot of, discussion nowadays about nutrition as medicine. And obviously this is very true in, many conditions, especially the metabolic ones and cardiovascular ones. But when it comes to the anatomy of our breathing, it just sounds a little bit counterintuitive, or it's not the first thing that, one would think about, right? As a matter of fact, the fibrous foods being a good way to train our jaws and widen our jaws and reduce the risk of sleep apnea is something that I guess very few people know. Are there any other things that you have identified either in your experience, or in the literature, that would be important takeaways for people to consider when it comes to eating better for breathing better?
Yeah. It's super important to eat where it doesn't create inflammation. And that's why I
Mm.
love that, with PNOE, you have this addition of a nutrition plan based on the breath test that people can
Hmm.
actually download on their phone and actually follow based
Hmm.
on their goals.
Hmm.
What I find is dairy creates a
Hmm.
problem for a lot of people, especially
Hmm.
probably in the US more so because of the
Hmm.
type of milk we have here.
Hmm.
A2 milk seems to create less of a problem, but still people who are, have an intolerance to dairy, they tend to have enlarged tonsils, more mucus, more
Hmm.
stuffy nose. So if
Hmm.
somebody actually comes and I see enlarged tonsils, so I definitely want to go through their nutrition plan,
Hmm.
decreasing the top three allergens, which are gluten and dairy, basically,
Hmm.
and then, of course, decreasing their sugar intake, or
Hmm.
at least find a substitute. And in my book, Heal Up, I do talk about sugar substitutes that are healthier. So I myself was a sugar addict when I was a kid living in Romania. So the one way I got off of it is just finding healthy sugar substitutes, and then that doesn't create that kind of craving and
Hmm.
spike in sugar in the blood.
Hmm.
So
100%.
yeah, I had constant chronic tonsillitis as a child.
Oh,
And
wow.
yeah, and of course it was because of my high sugar intake. However, the doctors didn't go there. They kept giving me antibiotics. And then finally my 20s, when I was here in LA already as a resident, I had my tonsils removed.
Mm.
But it wasn't the right approach. Unfortunately, my tonsils grew back. And finally, when I started studying nutrition, going to Institute of Functional Medicine, I understood the importance of a healthy diet. And I changed my diet, and it changed the way my tonsils responded to the food I was taking. So it really gave me a whole new.
So would you say that the degree to which our tonsils are enlarged or inflated or inflammated, I don't know what the right term would
Inflamed,
be in
yeah.
that case, I guess both, is a marker of whole body general inflammation? Is that a fair statement, or do you think we're overgeneralizing it?
I don't think so, because, as a dentist, I get the privilege to look in people's mouths pretty often, and we have good lighting. And
Hmm.
I see, you know, I don't think I've ever seen like pure healthy tonsils.
Oh,
There's
wow.
always a
That's a big
small
one.
degree,
Yeah.
right? There's always either a small degree of inflammation, moderate,
Hmm.
or more severe.
Hmm. No.
So, I mean, they're basically the pillars of our immune system, and they're there to protect, from pathogens. But
Certainly.
generally, people that have higher body inflammation, they will have more inflamed tonsils. It's just kind of a picture. I always say, looking in the
Hmm.
mouth is kind of the gateway
Hmm.
to our health. So when
Hmm.
I look in the mouth, I can see, okay, well, your immune system is
Hmm.
hyperactive, it's
Hmm.
inflammation. Yeah, we see a lot
I
of
see.
things.
And obviously that is a great conversation starter for removing pro-inflammatory foods like dairy or, refined sugars and whatnot. Uh,
Yes.
um, Now you mentioned that I mean, now or for a while you haven't seen any normal tonsils. How do we know then what a normal tonsil is nowadays? Has the standard completely shifted? Is there a standard anymore?
Yeah, and by the way, I highly encourage people to always do a self-exam. Look at your tonsils once in a while, kind of,
Yeah, that's
stick your
super important. Yeah.
tongue out, take a look. If you
Mm-hmm.
see inflammation or white spots, it means there's some kind of plaque in those little crypts.
Mm-hmm.
We all have these little channels inside our tonsils.
Mm-hmm. And
Um,
mhm.
Basically,
It's so interesting you say that because growing up, I was basically advised and taught that if you see these little spots on your tonsils, that's not, it is just a marker of like a viral infection. It's not a marker of general inflammation. I mean, growing up, like we never talked about general inflammation as a problem. We only focused on viral infections or things that would, get us in bed for like, a few days, but nothing of chronic nature. So very interesting you say that, these white dots may also be a marker of general inflammation, and it is something that we need to pay attention to.
yeah, and a tonsil hygiene, I think we don't talk enough about that. And going through my own tonsil problems,
Mm-hmm.
people that have recurrent sore throats, one of the things I want to bring to their attention is these little crypts or little channels inside our
Mm-hmm.
tonsils.
Mm-hmm.
If they're, bacteria can get stuck in there. Just like
Mm-hmm.
plaque on the teeth, we get plaque inside the tonsils. And they're called, they can form tonsil stones.
Mm-hmm.
These tonsil stones, oftentimes we actually see on the CT scans that we take in our office. And it's kind of like kidney stones, basically, same kind of concept. It gets calcified, dead bacteria, and
Mm-hmm.
gargling on a regular basis really promotes the cleanliness of the tonsils.
Mm-hmm.
And I think this is an important part of brushing your teeth. After you brush, you water floss, then gargle to kind of help to clean out the biofilm, because we have biofilm all throughout our body, in our mouths, around the teeth, under the gums, but also on the tonsils. And it's very important to practice this, like gargling of the tonsils, to be able to keep them as clean as possible.
Would you say that mucus or buildup of some sort of pathogen in the tonsils can lead to whole body inflammation, in the sense that enlarged and inflamed tonsils are not just a marker of generalized whole body inflammation, but they themselves can trigger, whole body inflammation if they are kept unclean?
Yeah, they absolutely can. I mean, people with, I remember even me, as I had tonsillitis, I had fever, I had
Mm-hmm.
body shakes. So yeah, and I had to be,
Mm-hmm.
I was on a course of antibiotics, it would take care of it, but it
Mm-hmm.
didn't go to the root of the problem. So yeah, absolutely. Depending on the pathogens that are in the mouth, strep, for example, can actually
Mm-hmm.
cause more
Mm-hmm.
severe symptoms,
Mm-hmm.
and it's transmittable,
Yeah,
definitely.
no, 100%, 100%.
Mhm.
So when it comes to understanding, your level of inflammation by evaluating tonsils, like, are there any tips for people when it comes to, looking at their tonsils on a, I would say weekly basis or like monthly basis? Like, are there some, is there some sort of advice you would give to people as to how they should evaluate what they're seeing in the mirror?
Yeah, I would just check in with your body. It's a great way to, stick your
Mm-hmm.
tongue out, kind of look, make sure you have some good lighting, look to see how your
Mm-hmm.
tonsils are. And sometimes you'll find one tonsil is inflamed, the other one is better. So they
I
might have
see.
something stuck in there. So start gargling, So a lot of people do
Mm-hmm.
salt water. You can put a little hydrogen peroxide in the water
Mm-hmm.
to help to sanitize. Ozonated water. I'm a big fan of ozone when it comes to biofilm reduction, even for the
Mm-hmm.
mouth, for people with gum disease.
Mm-hmm.
And typically people with gum disease, by the way, will have inflamed tonsils, or people with root canals that have bacteria stuck in there will have inflamed tonsils because it will react to something that's happening in the mouth. So
Mm-hmm.
if you find that you're gargling, your tonsil redness is still not going away, I would definitely
Mm-hmm.
recommend seeing like a biological integrative dentist to do a cone beam CT scan to see, is there something in the mouth, like an infected root canal that you're not feeling, or gum disease that is or cavitations in the jawbone, something I
Mm-hmm.
treat a lot, that
Mm-hmm.
might be causing your tonsils to flare up. There's
Mm-hmm.
always that possibility.
I see. Uh, you mentioned this type of CT scan that I'm guessing is different than the regular CT scans that we get in a traditional dentist office.
Yeah, so the cone beam CT scan is a digital CT scan,
Mm-hmm.
much less radiation than your traditional CT scan, even the medical CT scan. So a lot of my patients are like, oh, I'm just going to go to my medical office and get a
Mm-hmm.
full head scan. It's 50 times more radiation.
Oh, wow.
And secondly, dentists can't read it. So you really need to, in order to evaluate the teeth, we need the
Mm-hmm.
actual cone beam dental CT scan, which goes just from right under the eyes to look at the jawbone and, to see what's going on with jawbone inflammation and with the
Mm-hmm.
TMJ.
I see. Very
Mhm.
interesting. Yeah.
So
Uh,
anybody who has
mm-hmm.
removed teeth in their life, has a root canal,
Mm-hmm.
um, highly recommend to do, if you want to have longevity and optimum health, to
Mm-hmm.
have a biological dental exam to look at with a cone beam scan to look at jawbone possible inflammation.
Hmm. Which, as you mentioned earlier, may also include gum disease, which is something I'm guessing a lot more common, right?
About 80% of population, that's globally, has some form of gum disease,
Oh,
which is
wow. This is, yeah,
funny.
which brings me to the next point, which is, gum disease and its comorbidities with other, conditions that can be life-threatening. So, what would you say are the things that people should be mindful of? 80% of us, so most of us, have gum disease. How can that impact our lives, and what can we do about it?
Great question. As a periodontist, my specialty is to treat gum disease, but
Mhm,
it's changed a lot, my view of the way I look at periodontal disease. So I want to start with kind of explaining what that is. What is gum bleeding? What is gum
mhm,
inflammation?
mhm,
Well, number one is usually caused by a biofilm, by overgrowth of bacteria. That's what a biofilm is. And it could be
mhm,
bacteria, fungus, parasites, that's what a biofilm is. It kind of
mhm,
co-lives together.
mhm,
And this biofilm that's in our body, in our GI tract, that starts in the mouth. We also have, of course, biofilm on our skin. But in our mouth, usually that biofilm is regulated by stress, by hormonal changes, by diet, and by oral hygiene. Unfortunately, most people don't practice good hygiene necessarily. The number one reason is they hate string floss. But the good news is there's a great alternative, water flossing, which works really well. We have great scientific articles that it actually works better than string floss for most patients. Because what happens is people brush, but then in between the teeth, there's no way for the brush to reach there. So
mhm.
if we're not water flossing to push water through, or string flossing, for those of you who love string floss out there, bacteria gets left behind there. And what happens is it doesn't get oxygen. So it starts living off the cellular structure of inside the gum. So that's why gums start to bleed. Most gum disease starts in between the teeth. So good news is it is preventable and reversible to a certain extent. So my three top recommendations for home care with gum disease is brushing, and it could be a manual brush. It doesn't have to be, fancy electric, a water flosser, and a chewable probiotic, because really the microbiome is so important. And the chewable probiotics have been demonstrated to decrease the amount of plaque, decrease inflammation, and really help to protect the oral environment from pathogens.
I see. Um, so this is, obviously great advice if you want to prevent or reverse gum disease. Um, Back to my point about potential comorbidities, I personally know that cardiovascular disease is a major, has as a major risk factor,
Mhm.
having some sort of gum disease. Is there anything else in terms of like major conditions that can be either life-threatening or life-debilitating that stem or may stem from gum disease?
Yeah, and actually, I wrote an article a couple years ago that got published about the oral systemic connection.
Hmm.
So besides cardiovascular disease and heart attacks, it increases by 2 to 3 times. We also have early pregnancy terminations because of bacteria actually crosses the placenta. And these are studies done back in the 80s. And we know that it can lead to low birth weight babies for
Wow.
women that are pregnant and have gum disease. And also rheumatoid arthritis. There's a big link between one certain pathogen called P. gingivalis and rheumatoid arthritis. So usually in our intake, we ask, hey, do you have joint pain? And then we do a saliva test pretty much for everyone nowadays to see what specific bacteria do they have, because we can't just clean the mouth, we have to clean the entire body.
Hmm.
Also, Alzheimer's and Parkinson's, but especially Alzheimer's and brain inflammation, are linked to microbes and periodontitis. Dr. Bredesen wrote a book called The End of Alzheimer's. He talks about it, the pigeon organism that has been found in the brains. And, you know, what's interesting is his philosophy is like, you know, Alzheimer's as the brains are shrinking is really a result of biofilm. It's a protective mechanism for the brain to get away from the biofilm. So we know microbes cross the blood-brain barrier. Lung infections, especially, you know, for elderly, they can't brush their teeth well, you know, maybe they're in a nursing home or their dexterity is not good enough. That bacteria can be inhaled and cause lung issues and lung infections. So now we also find some links to cancer. Certain spirochetes can trigger cancer. So definitely we have large correlations between oral microbes and the body.
I guess this is, you know, very good, you know, motivation. It's not
Yeah.
for people to start flushing, whether that is string flushing or water flushing, and then, you know, getting, you know, all the things right when it comes to oral hygiene. I personally have never heard anyone go through a comprehensive list of, you know, very serious and debilitating diseases that may come from, you know, very basic things like not flushing or not brushing our teeth. So this is great information. Cool. And anything else you would like to add at this point before we kind of open it up to some questions from our audience?
I do want to encourage everybody, you know, to really pay more attention to the mouth. I think when we don't feel well, we assume that it's like, oh, maybe it's my body. Let me go to the doctor. And they find nothing wrong. It's like, you're fine, but you're not feeling well. So really, you know, starting small and, you know, definitely going to a biological or an integrative dentist is so important because we are able to connect the mouth to the body. But, you know, start doing small things. Even from water intake, a lot of people don't drink enough water, or maybe just start water flossing. You know, you hate flossing, you've never done it, you can start at any point. And if your gums are bleeding, don't worry, they'll actually get better very, very quickly because the mouth cells, they change very fast. Every 3 days, we get new cellular deposit. So it's good. So it's wherever you are right now, a small habit can cause a big change.
100%. And, you know, it's becoming, I believe, more and more prevalent that people consider oral health as part of the integrative, holistic approach to health. Indeed, it can be the, you know, root cause for many problems, and if we ignore it, we may go into great lengths to fix something in our body, or, you know, drop, you know, thousands, tens of thousands of dollars in treatments and diagnostics, but we may be simply, you know, overlooking something that can be very simple to fix. And yeah.
Yes,
So
exactly.
awesome. Well, thank you so much for all of that great information. I will now open it up to our audience, see if we have any questions. You can use the Q&A button at the bottom to type questions you may have. I guess most people were covered from this great topic / conversation we had. I would like to thank you very much for joining me today. That was a wonderful conversation. It is recorded, so, you know, we're going to disseminate it with all of our audience and user base. I believe there's going to be a lot of people that will learn a lot from that. And thank you so much again, and hope to reconnect again soon.
Absolutely. It's my pleasure. And if anybody wants to know more about oral health, I have the Holistic Dentistry Show, my podcast, which I talk a lot about oral health and other connections. I'm looking forward to collaborating more and getting some data on the PNOE and oral health.
Absolutely. We'll definitely make sure to mention your podcast and, you know, any other resource you believe is helpful for people to dive more into the oral and, you know, oral health and integrative dentistry. So that's going to be part of the message we put out. So thank you for bringing that up.
My pleasure.
Appreciate it. Have a good one and enjoy the long weekend. Appreciate it.
Thank, thank you.
Bye.
Bye.